So as I mentioned at the beginning of this event, building trust in science, thank you, Francis, is one of our primary ambitions. So this year, we are launching a new annual prize to recognize an outstanding science journalist, the Kovler Prize for Trust in Life Science Journalism. Journalists who focus on health and life sciences play a crucial role in translating complex science topics to non-scientists. They're important for building trust and for enabling people to make more informed decisions about their health care. So this new award, honors an individual whose distinguished body of journalistic work has significantly increased the public's awareness and understanding of life sciences. So here to speak further about this prize and introduce our inaugural awardee is Dr. Judy Lansing Kovler, an FNIH board member whose generous support through her foundation has made this award possible. The Judy and Peter Blum Kovler Foundation supports health services and medical research, among many other initiatives. Also joining us on the podium is Dr. J. Bernhardt, who chaired the jury that selected our awardee. Dr. Bernhardt is the president of Emerson College and formerly held leadership positions at several academic centers and universities and was the former leader of health communications at the CDC under my watch. And I consider Jay to be one of the best recruitments I made at CDC, and I feel very blessed to have learned an awful lot about communication from him. So thank you, Jay, for your service. Please join me on the podium.
Thank you, Julie. Tonight we honor and we are hearing about these incredible discoveries that the researchers have been providing for us. These discoveries will make the difference in the health and well-being of so many. But unfortunately, the pace of these discoveries are not in sync with the general public's view and trust of science. Let's face it, what good do all these discoveries do if people don't trust in it? So my husband and Peter Kovler and I, Peter down there, set up the Kovler Prize for Trust in Life Science Journalism to honor the work of these journalists who, as Julie said, translate these very complex science to us, to the non-scientists, so they could understand it and use it in their healthcare decisions. We set up this prize, the Kovler Prize for Trust in Life Science Journalism, to honor those who truly excel at it. I'm thrilled to be up here with Jay Bernhardt, who said was the president of Emerson College. He chaired the jury who chose our prize winner. I want to thank Jay and also thank all of the jury members who were people who were prominent in the fields of communication, science, and academics, who chose our first prize winner, Dr. Katherine Wu, who is the Atlantic staff writer and has done an incredible body of work. Now, Jay.
Thank you so much. Let me first say what an amazing boss I had in Julie Gerberding at the CDC. Please join me in thanking Judy and Peter Kovler for making this award possible and for recognizing the incredible role that journalism plays in educating the public and building trust in the life sciences. Let's give the Kovler family a big hand. Thank you. On behalf of our esteemed jury of judges, I'm deeply honored to present the inaugural Kovler Award for Trust in Life Science Journalism to Dr. Katherine Wu. Katie Wu's outstanding contributions to science communication demonstrate the highest journalistic standards and underscore the critical role of credible and trustworthy journalism. The jury judged Dr. Wu's work to be highly accessible for public understanding, credible in its commitment to truth and facts, and critical to building widespread trust in science, attributes that perfectly describe what we seek in our awardees. As a former leader of health communication at the CDC and a longtime health communication scholar, I'm, like my colleagues, we're increasingly concerned about the number of people who don't understand science and question the accuracy and credibility of science and scientists. This is a real problem, and journalists have a crucial role to play in helping us address it. A scientist turned science reporter, Dr. Wu holds a PhD in microbiology and immunology from Harvard, and much of her work is focused on infectious diseases. Before joining The Atlantic, she was a science reporting fellow at the New York Times, where she covered many aspects of COVID-19, and her work has appeared in such prestigious outlets as National Geographic, Popular Science, and Scientific American. Please join me in congratulating Dr. Katherine Wu as the first recipient of the Kovler Prize. Unfortunately, Dr. Wu is not able to be with us in person tonight, so she's provided some remarks by video.
Thank you so much to the organizers for this opportunity. I'm really sorry I couldn't be with you all in person today, but based on just scrolling through some photos of past ceremonies, rest assured that I'm feeling just the appropriate amount of FOMO. It truly is such an honor to receive the Kovler Prize, especially for my work on the pandemic. COVID-19 took millions of lives and continues to claim more each day. It's disabled countless others with long COVID. It's a pandemic that's exacerbated inequities, laid bare serious flaws in many health delivery systems, and driven divisions at a time when the world should have come together. And through it all, it's challenged the public to keep up to date with a deluge of scientific discoveries, and somehow, at the same time, sift through at least as much misinformation. Navigating this as a science journalist has been one of the most difficult tasks I've ever undertaken. I want to give my readers clear, accurate information and a guide for how to think through not just the decisions of today, but of tomorrow and beyond, which so often feels impossible when even the world's leading experts are sometimes scrambling to learn in real time. But the stakes are high. Throughout all of my writing, I've kept in mind that the public needs to understand what aspects of science are solidly backed and which are still very much in development and subject to quite a bit of change. As much as we now understand about the world, it's also true that understanding is fluid. New data are constantly pouring in. The answers that feel correct today may very well not be appropriate tomorrow. And the more the public is acquainted with this idea, the better equipped they will be to trust when science leads them in the right direction, and to know when to scrutinize and when to push back, especially when the needs of the most vulnerable are not being met. With the help of the Kovler Prize, I hope to spend the rest of my career ensuring that my readers understand the vital role science plays in their lives. None of this would have been possible without the dedication and hard work of my editors and colleagues. Journalism, despite typically having single bylines, is really a team sport. I'm especially grateful to my editor at The Atlantic, Sarah Laskow, who has always steered me straight, kept my word count down, and encouraged me to write boldly and innovatively, and to not be afraid to sometimes challenge conventional thought. I'm incredibly grateful to her and everyone else who has made my experience at The Atlantic such a formative one. Thank you again to the Foundation for the National Institutes of Health and to everyone for attending tonight's event.
Well, I can't wait to thank Dr. Wu in person. Her skill at conveying clear and accurate information about COVID was remarkable, and I encourage you to check out her recent articles in The Atlantic because they're really outstanding, and I sure learned a lot by reading them. As new health challenges come up, we're going to continue to depend on top-notch journalism to sort through data and help ensure that people have the information they need to make health decisions. So we look forward to sustaining this award, and I do want to thank not only the Kovler family for their support and Jay for his leadership of the jury, but the jurors who came together on extremely short notice, established the criteria for this award. I also thank the people who helped solicit nominations. We had outstanding nominations. It was a hard decision, and we look forward to raising the visibility of this award and continuing this effort going forward, because we think it really is a foundational component of what makes our work successful, but also what really allows the good work going on at NIH to ultimately be translated and trusted by the people who need it.